Classification of pressure injuries. Understanding the stages is essential for accurate assessment, documentation, and treatment planning. Stage 1. Stage 1 pressure injury. Stage 1 pressure injury presents as non blanchable erythema of intact skin. The skin is still closed, but the color does not turn white when pressed. The area may feel painful, firm, soft, warmer, or cooler than the surrounding tissue. Stage 1 is an early warning sign. Pressure is causing damage beneath the surface, even though the skin has not yet opened. Stage 2, pressure injury. Stage 2, pressure injury involves partial thickness skin loss. This means the damage extends into the epidermis and dermis, but does not go deeper than the dermal layer. Typical findings include a shallow open wound, a pink or red wound bed, or an intact or ruptured blister. Important note, stage 2 never includes slough, eschar, fat, or deeper tissues. It is strictly a partial thickness wound. Stage 3 pressure injury. Stage 3 pressure injury is a full thickness skin loss. The wound extends into the subcutaneous tissue but does not reach the muscle, bone, or fascia. Two important features may be present. Undermining. This is tissue destruction under the intact skin along the wound edges, creating a shelf or lip. Tunneling. A tunnel is a narrow channel like passageway that extends outward from the wound. Stage 3 injuries vary in depth depending on the patient's body weight and the anatomical location. Stage 4 pressure injury. Stage 4 is the deepest category of pressure injury. It involves full thickness skin and tissue loss with exposure of muscle, tendon, ligament, or bone. Because the bone is exposed, the risk of osteomyelitis, a bone infection, is very high. Stage 4 wounds are serious and may involve extensive tissue necrosis, undermining, or tunneling. Unstageable pressure injury. An unstageable pressure injury is a full thickness wound, but the depth cannot be determined. The wound bed is covered with slough or eschar, and the true tissue damage is hidden underneath. Until the necrotic tissue is removed and the wound bed is visible, the injury cannot be staged. Deep tissue pressure injury, also called DTPI. A deep tissue pressure injury appears as persistent, non-blanchable red, maroon, or purple discoloration. The skin may be intact, or the patient may have a blood-filled blister. This represents damage to the deeper tissues beneath the surface, often caused by intense pressure or shear. Even though the skin may look intact, severe underlying injury has already occurred. Healing and staging rules. A pressure injury never heals backward through the stages. For example, a stage 4 injury does not become stage 3, stage 2, or stage 1 as it heals. Instead, it is documented as a healed stage 4. The tissue will never return to its original strength or structure. Conclusion. The stages of pressure injuries include Stage 1, non-blanchable erythema. Stage 2, partial thickness skin loss. Stage 3, full thickness skin loss with possible undermining and tunneling. Stage 4, full thickness tissue loss with exposure of deeper structures. Unstageable. Depth cannot be determined due to slough or eschar. And deep tissue pressure injury, a purple or maroon area signaling deep tissue damage beneath intact skin. Accurate staging improves communication, guides treatment, and supports proper wound healing.